Right. Hi, everyone. Thank you for joining us for today's webinar. My name is Wagata Semere. I'm the director of the Champion Provider Fellowship. So pleased to have you guys here with us and to have UC ANR here to host today's webinar. I'm going to turn it over to Nancy to go over some logistics.
Yes. Hi, everyone. I'm Nancy, the project manager for the Champion Provider Fellowship. And before we begin, I want to let you know that this webinar will be recorded and we will post it after our website is completed being migrated. UCSF is doing this migration thing for our websites right now. So sometime in November, it'll be posted. Our attendees will be muted during the presentation. For best viewing, please put your Zoom in full screen mode. Questions and comments can be entered into the chat box. I will be monitoring that. And if you have any TA requests, please message me. And I guess we'll go to the next slide. For upcoming events, we are currently rescheduling our November web call, the joint web call for fellows and LHDs. So the poll was sent to our current fellows as well as our current LHDs. So please complete that poll. And our upcoming web calls are in February and also May. And please stay tuned for more information on further programming. We are planning more webinars and other in-person events. I'm going to hand it over to Wagata.
Great. So I'm pleased to introduce today's presenters from UC ANR. First, we have Amira Resnick, who is a statewide director of UC ANR's Community Nutrition and Health Program. Amira Resnick oversees the network of UC ANR community nutrition and health programming across the state through the Expanded Food and Nutrition Education Program and the CalFresh Healthy Living UC program, and guides special projects and emerging initiatives that expand UC ANR's work in community health and well-being. Next, we have Claire Gibson, who is an assistant clinical professor of pediatrics at UCSF. Dr. Gibson is a general pediatrician who practices primary care and teaches at UCSF branch campus in Fresno. She's passionate about newborn medicine, community health, and medical education. As part of the UCSF UC ANR collaboration, she has been working on 2 project teams, one focused on lactation support and the other on mental health. And our third presenter is Atara Tarani, who's a program coordinator at UCSF Center for Child and Community Health, working on projects related to the UCLA-UCSF ACEs Aware Family Resilience Network. She serves as a family partnership team member in the Building Capacity for Trauma-Informed Pediatric Care project at the American Academy of Pediatrics. She's also a youth advisor at the Department of Psychiatry and Behavioral Sciences at Stanford University School of Medicine. Very excited again to have you all with us. Looking forward to the presentation. We'll allow time for Q&A after the discussion.
Thank you for that great introduction, and thank you for having us to join you for this webinar. I have a bunch of slides I'm going to probably go through pretty quickly in order to pass it on to Satari and Claire, who's going to speak with you more. But we're titling this session with you Building Bridges, because we're really excited to discuss and explore how we can continue enhancing health and nutrition through partnerships with UC Ag and Natural Resources, UC ANR, and to describe to you a little bit about how we've been doing that with our UCSF colleagues. Next slide. So as Wagata already introduced us, we can move on to the next slide. This gives you a bit more of the deep bench of wonderful faculty through UCSF that we've had the privilege to partner with over the past 3 years or so. So you can see various folks representing the healthcare and clinical perspective. to combine with our UC ANR team on the next slide. A couple of them who are here in the Zoom room today, which is great. But we do have a statewide presence of community nutrition and health advisors and specialists, our own version of faculty within the UC system in our division. And many of these folks have local regional assignments where they do their research and extension work. And also we have our specialists who have a statewide or even national purview in the projects and work that they do. Next slide. Our objectives for today are really to introduce you to our organization, describe the history, the mission, and the impact of UC ANR, and to summarize our growing collaboration with UCSF and the potential benefits of this partnership that we continue to explore and delve into at every turn. And we also want to explore future collaboration between UCSF, UC ANR, and including any and all of you on this call and within your own networks. Next slide. So we really have at UC ANR quite a broad mission of reaching all Californians by bringing UC information and practices to local communities and work within local communities to improve all of our lives and our livelihoods. Next slide. In order to do this, we seek to be in right relationship with all of our fellow residents across California. And one of the practices that is a health equity driven practice that we have for spaces like this is to start with a land acknowledgement. So I'd like to read this and give all of us an opportunity to acknowledge that this event is taking place throughout the unceded territory of California, home to nearly 200 tribal nations. So as we begin to discuss this event, we acknowledge and honor the original inhabitants of our various regions. A land acknowledgement is a critical step towards working with Native communities to secure meaningful partnerships and inclusion in the stewardship and protection of their cultural resources and homelands. Let's take a moment to honor these ancestral grounds that we are collectively gathered upon, and to support the resilience and the strength that all Indigenous people have shown worldwide. UC ANR has working groups and several of our colleagues across the state who are working very actively with tribal communities and tribal partnerships, and we can share more about that topic if you're interested. So on this slide, I wanted to just acknowledge that we have a long history as part of the UC system as our land grant university in California. This is part of a national cooperative extension network that I'll share a bit more about that was established in 1862, a long time ago, right? And it was an act of Congress that put into place this system that has grown and evolved until today. Next slide. So it was federally established to be funded with federal funds, state funds, and local funds. So you see here depicting the various levels of funding and structure that support our institution, similar to other institutions across the country. Our funding comes through USDA, NIFA, and supports our whole network of state entities and facilities and staff and academics as well. And we also work within each county in California. We have a presence and an office in all 58 of our counties, and our county governments are also contributing staff, space, resources, budgets, as well as volunteers to our structure and to our organization. Next slide. This, I know it's too small to read this slide, but it gives you a sense of the variety and abundance of land grant universities and colleges across the country. So in every state and in the territories as well. In California, we are the only current land grant university operating. And again, we function throughout the state, but very much in network across the whole country with similar public institutions that have a very similar mission longstanding and with a similar legacy and history to ours. Next slide. So back to our broad mission to reach all Californians, we do have several key areas that we've been working in over many, many years, and you see these listed here. So we are focused on safe, sustainable, nutritious food production and delivery. We're focused on economic success in a global economy, a sustainable, healthy, and productive environment, and also science literacy and youth development. And I'll talk a little bit more in detail about those in the upcoming slides. Next slide. So you see on the right-hand side a list of our various statewide programs and institutes. I mentioned youth science literacy and youth development. So if anyone has heard of the 4-H Youth Development Program, that is part of the Cooperative Extension System. Very key program within our state as well. Our CalFresh Healthy Living UC program, which is our SNAP-Ed funded program. We are one of the implementing organizations of SNAP-Ed in California, and our FNET program as well. You can see all of the other statewide programs and institutes that are part of our organization. And you see our footprint of nearly 200 academic advisors, such as those focused on nutrition and health. We have them across many different disciplines as well. We have staff who serve as community educators and really a variety of titles and functions within the different programs as well. And we have various academic specialists driving research in many of these areas as well. And we are affiliated with several UC campuses, and our colleagues are based, several of our colleagues are based in UC campuses as well as the folks that are based in our county offices in all 58 counties. Next slide. So this is a depiction of a little bit about how we like to talk about our impact. Just some examples of how we engage in training up volunteers to deliver educational programming across several of our programs and institutes. We engage in policy activity, policy engagement, and actually our position to grow in that work as well, and with our future-facing strategic vision. We do tons of community-facing education, workshops, curricula delivery, courses, all kinds, shapes, sizes, topics, etc. And then I love that featured on this slide, you see our expanded food and nutrition education program, which among the outcomes that we're proud of with that program is the funds and the household funds that are saved on food resource management, saved on groceries with the programming that we deliver across our communities. So just a few examples. And then all of the folks I described that our academic faculty are very engaged in public research and publications of all of this good work that we do. Next slide. We also function in every area in partnership and collaboration. So that is absolutely the way that we do our business across disciplines. So on the right-hand side, you see just a few examples of our many, many, many partners across the state, local partnerships, statewide partnerships, national partnerships, etc. And some of the ways that we partner are on research projects with other organizations. We serve as subject matter experts in many cases. We provide training on different content areas with these types of partners. And we have train the trainer programs as an example where we train other organizations to then go on and train within their own organization or other organizations out in the community. We develop educational materials as well, curricula and beyond. And we do all kinds of feasibility studies, needs assessments, etc., in order to inform all of this work. So the example here is around mapping future fire probability in our climate change initiatives. As you saw in previous slides, we're committed to stewarding natural resources and working with agricultural lands. And so that example is lifted up here as well. And I mentioned our SNAP-Ed program, our CalFresh Healthy Living program. So being able to provide and deliver evidence-based educational programs like that is another way that we partner across the state. Next slide. We have a new strategic vision and strategic plan, and this is meant to serve us through 2040. And there are 7 key challenge areas that we've identified with many stakeholders through our strategic planning process. The first 4 that are listed here talk about our different kind of content area domains: ag and food systems, natural ecosystems and working landscapes, thriving people and communities, which includes that entire piece around community nutrition and health, youth development, and more, and community economic development as well. And climate change, innovation, regulations, policy, and compliance, and system inequities are other challenges as well, particularly cross-cutting challenges that we aim to work at from an interdisciplinary approach. And you can find this full document if you're interested on our website. It's our strategic vision. Great, next slide. And we feel that our work has been around for a long time, and it's needed now more than ever. We are really, especially with our new vision and plan, really well positioned to advance innovation, advance new technologies needed for agriculture and supporting our natural resources, particularly in California, but across the country and even the world, addressing climate change impacts, addressing all of the economic factors that are really important to people's life and livelihoods, and very importantly, addressing disaster preparedness and response. We have a division-wide disaster readiness and response team, bringing people across different disciplines together to work together on coordinated participation in our communities on these topics. Next slide. So we are very committed to continue our work, growing and thriving, and partnering with many folks across our disciplines and who also care about all of these topics and all of this work. Next slide. I want to talk a little bit about specifically community nutrition and health. I mentioned on that map slide various advisors and our faculty, our specialists that work on this topic, in addition to our staff, our educators, and more, who are really comprise this network of researchers and educators that are committed to advancing integrated approaches that promote holistic health and equitable communities for all California. Our vision statement is that we envision an inclusive and thriving society where all the people of California can enjoy holistic health and well-being within equitable communities and free from chronic disease, and with the benefits of social connection and belonging. Next slide. We think about our work in 4 areas of health, 4 domains. So a lot of our work addresses physical health, the way that we care for our bodies. And we are doing more in this space of psychosocial health, particularly how nutrition is integrated with mental health and how we can leverage those topics together. We also address economic health in a few different ways. I mentioned the FNET program and how we look at food resource management and the savings that program can bring for households monthly savings on groceries as just one example. But we also look at environmental health in many different ways. Lots of colleagues work on food systems in particular, and we have a lot of intersection in that work with our Community Nutrition and Health Network, working on policy systems and environmental approaches toward public health, and there's a variety of work in this area as well. Next slide. Looking into the future, this is a little bit about how we anticipate our medium and longer term outcomes. So some specifics of the things that we are seeking to advance. Certainly continuing all of our work in increasing intake of fruits and vegetables, increasing physical activity, addressing food security, and really looking to increase the over the long term, and broadly speaking, increase the quality of life and the health span of all Californians. Next slide. And with this kind of transitioning to talk about how we've been partnering with UCSF and the healthcare sector, this spectrum of the care continuum has been one that inspires me to imagine how we can help to be a conduit for bridging across the promotion, prevention, treatment, and maintenance spectrum of health care, where with UC ANR, we are certainly focused on health promotion across community levels, working with individuals and families, working to prevent chronic disease and other health-related ailments. And happy to be doing so in collaboration with our healthcare professionals, having consistent messaging and working hand in hand however we can on the treatment and maintenance areas that are their expertise. So with that, I'd love to pass it off to Claire to continue talking about how we've been working together.
Thanks so much, Amira. So as was mentioned at the beginning, I'm a general pediatrician and faculty member at UCSF at our branch campus in Fresno, so based in the Central Valley. And I imagine I wasn't alone when I first started this partnership a couple of years ago. I didn't think I knew what UC ANR was, embarrassingly, as a native Californian and a graduate of a UC and a faculty member now at a UC. But with Amira's great introduction, maybe you've had the same realization that I did, which is I absolutely have touched UC ANR in so many ways through my life, and their programs like FNAP or 4-H. You start to realize that you do know what UC ANR is. It's just their work is so vast and so incredibly embedded in our communities that we may not recognize that that work is under the umbrella of this part of our UC system that is UC ANR. So as Amira said, I'm going to share a few slides with you to talk a little bit from the perspective of a provider, of a pediatrician, as I know many of you are part of the fellowship and providers yourself, and share a little bit of kind of concrete examples about how we've been collaborating over the last few years. Our collaboration was really founded on this shared commitment to advance health equity at UCSF as one of the UC's primary kind of health training campuses. And as Amira described, UC ANR, a key goal of theirs is advancing health equity as well, and to really work together to deliver evidence-based health information to our communities statewide. And what an opportunity using UC ANR's network across the state to be able to work together to do that. So next slide. So as a group of kind of leaders at UC ANR in the health and nutrition focused sector of it and UCSF, we've been working to co-identify some priorities, some health topics that will not only leverage our strengths as researchers and educators from UC ANR and UCSF clinicians, but also kind of capitalize on our separate areas of expertise to really work on developing resources and strategies to advance the work we're doing in those priority areas. So next slide. As part of that work, we've identified 5 kind of main initial priority areas that we've been working together in, and 5 project teams have formed, each interdisciplinary with folks from UC ANR and UCSF on the team. And I'll briefly review these 5 and then talk to you specifically about 2 of them that I've been part of to give some more concrete examples. So one of the group has been working on dietary guidelines, working together to create kind of evidence-based nutritional handouts based on some of the top chronic diseases across the US and specifically for our state. A second group has been working on health equity in the breastfeeding lactation space, and specifically has been looking at farm worker populations, a big population in the California region, of course, for us in our state, to try to see if we can develop better strategies for breastfeeding support. Our third group has been focused on elder health and working to make a statewide plan to promote health equity for our elder population, look at nutrition to reduce health disparities, and improve access to senior-friendly health tools. Our fourth now, I can count. Our fourth group has been focused on mental health and really trying to help make sure we've got good resources and illustrations to show the link between mental and physical health and nutrition. And our last group at the moment has been working on Medicaid, specifically working on strategies to teach communities about Medi-Cal eligibility and benefits, and trying to reduce barriers for undocumented individuals. So I'm going to zoom into two of those groups. I've been a pediatrician clinician working on the lactation group and the mental health group. So I'll take you to that next slide. So first I'm going to talk about our mental health group. This is a draft of a graphic, kind of an infographic that our group has been working on. And Satari is going to talk a little bit more about kind of how we have developed and brought this graphic to where it is. But this is an example of how our group has leveraged our expertise, our health knowledge as clinicians and as researchers and educators to develop a tool that can really be community facing to educate about the interconnectedness between nutrition, mental well-being, and physical activity. On the next slide, the same mental health group has been working to develop kind of a resource database of evidence-based tools, so be that studies, materials, for the UC ANR advisors to use and inform their practice. And these are all kind of tools and existing resources that we've cataloged together to help kind of address issues around mental wellness, and specifically mental wellness's connection to nutrition and physical health. So that is another effort that this project team has worked together to build, knowing that there's a lot out there around this topic, but it can be hard to, in a moment, kind of access materials you need to do your work in communities. So transitioning to the second example on the next slide of a project team, the other group that I'm working in our collaboration is the group focused on lactation and kind of breastfeeding equity. This graphic is a poster we were able to present at a recent conference that shows some initial results of our work. But as a group, we've actually developed a research study that we're doing, an initial survey of breastfeeding parents or parents who have newborns born in the last few years to try to understand their breastfeeding kind of perceptions, experiences, barriers, specifically focused on parents who work in agriculture. Our hypothesis being that those who work in the fields may experience some unique challenges to breastfeeding, despite kind of state laws that should protect a parent's right to breastfeed or pump once returning to work. So we have some really interesting initial data back from our surveys and are continuing to collect both in the Salinas Valley, where one of my colleagues from UC ANR has deep connections through her work at UC Berkeley and the Chamacos study, if anyone's familiar with that group of studies. And then we're also conducting surveys here in the Central Valley, where I'm based at UCSF Fresno. So our hope is that that work will really inform some resources, recommendations that we can make to help make breastfeeding more feasible for this population if they desire to breastfeed. All right, and I think with that, I will transition to Satari, who's going to give you a little bit more information about how we're doing this work.
Thank you. So very central to our collaboration is incorporating lived expertise. We have something called Community Advisory Committee, or the CAC, which is composed of 14 community members from 9 counties across California. And the map shows you where they are geographically located. Many of our CAC members are current or former participants or community partners of the Expanded Food and Nutrition Education Program, FNAP, or California CalFresh Healthy Living, federally known as SNAP-Ed. And the CAC was really established to ensure that community voice remains central to UC ANR's community nutrition and health efforts and our collaboration. And really, the CAC embodies the belief that those with lived experience are essential partners in creating effective, sustainable, and equitable solutions. And the RCAC members bring firsthand knowledge of community nutrition, food access, and health challenges. We have monolingual Spanish speakers, and they provide feedback to all of the priority areas that Dr. Gibson showed previously. On the next slide, we actually have an example of how the CAC has provided feedback on one of the deliverables, as Dr. Gibson mentioned, for the mental health project team. You can see on the left-hand side the first version that did not have the CAC feedback, and on the left you can see the version that had 2 rounds of feedback. And sorry, on the right you see that one. And then basically the CAC really shared like insightful feedback to make the flyer more engaging to diverse communities. For example, they told us that they like to see the flyer in a horizontal format because it's easier to read. And then again, we have all of our materials translated to Spanish for our monolingual Spanish speakers, and they suggested title and wording changes. And it's more accessible to make it more accessible to communities. And then also, lastly, I would just say they recommended that we use more colorful icons and better pictures. So, for example, we added more examples to the nutrition circle, such as legumes, nuts, and then also the fish icon was added. And, overall, our CAC's thoughtful feedback helped make the flyer more visually engaging, culturally inclusive, and also more accessible to diverse communities that it hopes to reach. And I'll pass it back to Amira.
So we wanted to kick off some discussion. Oops, can you hear me? We wanted to kick off some discussion and engagement with you all on any ideas what we've shared might be inspiring in you about potential ways we could collaborate and or support each other to do work that we all care about and potentially be more impactful together than we are on our own. So there's one good question in the chat already that I'd love to respond to about examples of, or in the Q&A I saw, what are some examples of policy engagement? And I think this ties into some of the ideas we wanted to offer and discuss around ways that we could collaborate. And so let me try to address all of those. But certainly one area is research opportunities. So to the extent that any of you are engaged in or interested to participate in any way in research projects and on these topics that we've discussed around community nutrition and health, that certainly could be a ripe area for collaboration. And I would say even approaching building connections from a place of networking and sharing resources, staying informed about existing work opportunities is also another great way to potentially collaborate. On this slide, you see the example of City of Hope, because that was a recent collaboration that has come about, bridging our community nutrition and health programs with the medical team at City of Hope, or a researcher, I should say, focused on breast cancer and realizing how impactful nutrition education was with her patients and wanting to build out not just a research, but a programmatic intervention with her patients. And so that was actually location-based, I think county-based out in Riverside County opportunity to collaborate with a physician over there. We have had other experiences where our specialists have done projects and programming where they are connecting with clinics and clinicians to refer participants or patients to our expanded food nutrition education program. We have some experience in that and certainly room to continue to explore and grow what is most successful there, where clinicians can support and refer any of their patients to these types of community education programming that may be beneficial to them. And on the topic of policy engagement across our organization, there's a couple examples I'll try to uplift. I'm going to put into the chat one of our statewide programs. Let me see how to reach everybody. Actually, I don't know how to put in the chat. Oh, wholesale panels. Here we go. So we have an institute called the Nutrition Policy Institute, which is focused on nutrition and increasing physical activity, and they're specifically focused on policy work. And so they do program evaluation, they do research projects around policy measures, whether it's related to WIC, whether it's related to universal school meals, is just a couple examples. They certainly do all of that, the research on those policy-driven measures, but also write policy briefs that can be useful for elected officials to understand kind of the research and the evidence by some of these policy decisions that they're making. The other thing I was going to share real quickly on the policy topic is that as part of our 2040 vision, ANR had this announcement earlier this year that we are building out a broader policy institute, launching a broader policy institute. So you can read about that in this blog I posted in the chat, with the purpose of engaging even more and more widely with our policymakers, bringing evidence-based information, analyses, et cetera, to our electeds so that that can inform the policymaking process, and also informing our own academics and training them up on how to engage and how to communicate science and science learnings with and for our electeds and our decision makers. So those are a couple of examples. Do we have other slides?
I think that last link, Nancy, if you could forward that to everyone, the last link Amira mentioned.
Thank you. I guess I didn't have access to send it to everybody.
No problem. Thank you so much for such a comprehensive overlook on a lot of the work that you guys are doing that I feel like touches so many spaces and places geographically and areas that you're working in. One thing that I might follow up on while we're waiting for others to think about any questions that they might have, and feel free to type those in the Q&A or raise your hand and we'll unmute you, is as we're thinking about research opportunities, I think sometimes there's like a big R, little r research, and some folks who haven't engaged in formal research can feel a little bit intimidated, and just curious what sort of opportunities there are for support and the degree of kind of engagement that some of our providers might be able to step into.
I think that's a good broad question around where would be like a starting place, right? And that to me goes back to the opportunity for creating opportunities for ongoing networking and learning about, who's doing this work within each of our organizations. And so I want to share another link to our network of community nutrition and health folks for you to explore. I'll drop that in the chat in a minute, because I saw someone else, and let's see who in the Leanna, if I'm saying your name correctly, is interested to collaborate, and you're based in Santa Barbara, sharing a bit about your experience. Really appreciate you writing writing what you did in the Q&A around your experience working with immigrant populations and a local project with a local NGO. We have colleagues in programming in your area on nutrition and health. And I'd love to be able to make introductions and set up future meetings if appropriate to make some particularly local connections and see what may be possible for you. And I'm happy to do the same with anyone else who would be interested to network and engage. I think of those within our ANR network that I shared that are on the call. We have Southern California represented today, and we have Marin and Napa County here.
There's another question here too, about additional future training or TA opportunities to be aware of that you guys may be putting on that this group could have access to.
Great question. We certainly, as soon as I can get this website to you, we have some of our past webinars and professional development opportunities that we'd love you to check out if you're interested. And it would be great to be able to circulate any upcoming events with you. I'm trying to think on to Satara if we have anything already scheduled, but if there's interest in that, we can absolutely make it a practice to share with you when we do have something that comes up next.
That sounds wonderful, and we're happy to kind of facilitate that process for you guys and share it through our contact lists. And another question from Abby about opportunities to integrate oral health specifically with nutrition efforts or collaborations with dentists.
I'm thinking about our sugar sweetened beverage webinar, Amira, and how great it would have been to have dental collaboration there. It's a great opportunity.
Agreed. A lot of this starts, like, at least I think in our experience, if I could speak for the collaboration, in visualizing like the conceptual and the conceptual and the science-based links, and then making that into something that's practical that any of us as practitioners or administrators can benefit from for professional development purposes and how we engage in our own work. And then, of course, if there are, public-facing resources that we can develop to do that even better, that's where we would and have gone next. So I think the example we shared today around mental health and nutrition, that connection, we certainly took a similar path to that, where we, discussed and engaged amongst ourselves, learned what we could, identified like what are those bridges and how do we bring that content to our communities, and would be really interested to do that with oral health as well. I am my own dentist there. I was inspired by a booklet that they have just for their patients that discusses the connection between oral health to all kinds of many other physical, whether it's diseases such as cancer or all of the impacts on prenatal care. And it just went on and on. It was really, but very in a simple way. So I loved that as a community-facing resource, and it inspired me for the type of engagement we could do along those lines as well.
That's wonderful. And we talk, I guess that makes me think of one other question. We talk a lot with our fellows about different levels of engagement, being sort of like an amplifier, an expert in these different degrees. And are you guys looking sometimes for folks based, following up on Claire's comment to sort of chime in or help contribute in that way, where it's sort of these, attend a few sessions, help contribute to material, like that kind of thing, providing expertise? And is that kind of another opportunity to partner?
I think it could be, depending on the event. So our advisors include, in addition to our statewide programs, our advisors are involved in other programming and projects. And I think there may be any number of opportunities for guest speakers or, co-hosting or co-facilitating educational events and activities, and even just being able to stay connected in ways that that we're able to uplift that opportunity and interest would be a great next step.
Great. I think we will certainly look forward to staying in touch about those opportunities and providing linkages where we can and updating folks on programs, opportunities where they might be able to partner. And I think Pam is looking for that booklet from your dentist, Amir. I don't know if it's your personal dentist, but yeah.
It is. I will try to find a way to share it, see who created it, if I can find a digital version. But I loved it. Yeah. And I'm going to have to share out with you. I'm not successful at finding the links that I'm wanting to share, so I'll have to circle back with the group if that's okay. Wagata, if we could send some follow-up resources with everybody.
Yeah, definitely. I think you have a lot of enthusiastic folks who are excited to follow up about ways to partner. And Pam, I think you'd raised your hand. Did you want to? We can unmute you if you have a question.
I've unmuted Pam.
I think Abby as well. I think you guys are both unmuted if you'd like.
Pam said the microphone's not working in the Q&A.
Oh, no.
Someone did mention also in the Q&A that there are counties oral health programs involved with the UCSF Champion Provider Fellowship, and if that person wouldn't mind saying which county that is.
Maybe we can unmute everyone if possible, Nancy. Let's see if that works. Sorry about that. We'll see if we can unmute everyone. Okay. So the problem is on your end. Oh. Okay. Well, it sounds like Pam, who's also another one of our dentists, was just noting that she's enjoyed the presentation and would love to also be involved in learning about future opportunities, research opportunities with oral health and nutrition.
Abby's also unmuted. I think he raised his hand.
Hello. Hi, can you hear me?
Yes, we can hear you.
Okay. No, I just wanted to say thank you so much. I love the presentation and the impact that UCNR and UCSF is making. Yeah, and I'm really excited if you guys have any opportunities that we could collaborate on where we can bring dental perspectives, because I know as a dentist working in community health in Madera County, exactly the same topics what you mentioned. We are working on the same with oral health, nutrition, agricultural communities, and with children as well. So I would love to get involved with any interdisciplinary collaboration that you guys might have, and open to collaborate and help in any way I can. Just wanted to say thank you so much.
Wonderful. Thank you.
Doing another scan to see if we missed any questions. But yes, as I think hopefully as you guys have seen, we have a lot of enthusiastic folks excited about the work that you're doing, the impact that you have, and then who are looking forward to opportunities to partner. And thank you so much for this presentation and really just providing some thoughts about ways to continue the work in collaboration, and we're looking forward to doing that.
Thank you all so very much. We're looking forward to it too.
Yeah.
Hopefully we can say, I know there's good stuff in the chat too, so hopefully we can save and share that out later as well.
Yes, and we can save some of those links that you sent out to so that we can recirculate those to those who were not able to attend and I'm sure very interested in these resources as well. We'll also be posting a recording of the webinar within hopefully a few weeks or so. Our website is almost back up and running after some updates and can add any other resources that you guys would like us to pass on at that time too.
Perfect.
Great. Well, thank you again to everyone for joining us. Thank you to our presenters. Really looking forward to staying in touch and feel free to reach out to us with any follow-up questions and we'll stay connected with our UC ANR collaborators as well to pass on any follow-up inquiries you might have.
Thank you all for the time today and for your engagement and for the work that you do. And I would look forward to staying connected.
Great.
Great. Take care, everyone.
Take care. Have a great rest of the
Thank
afternoon.
you.
There's one question that came on, and John is still here.
I
Oh, I
just
did see
saw it
that.
as
Yeah.
well.
Yeah.
Oh, okay. What impact does policy and budget changes at the federal level, state levels have on UCA? John, if you're still here, I'm happy to speak to that a little bit. In our nutrition and community health world, the biggest impact has been the loss of SNAP-Ed. It's been devastating, I think, for us, and I know it's impacted your program as well in meaningful ways. We have, I think it's for ANR, it's certainly perhaps our largest statewide program in terms of our staffing footprint and budget, of course. And so we are in the midst of that right now, needing to close that program. And it's really been kind of all hands on deck with human resources and our leadership, and obviously the whole team itself navigating that, and with our funders. That's really the big one in my purview. And then more broadly within ANR, we did lose another significant federal grant that was focused on agricultural. I think it was focused on food systems. I was not directly involved in that one, and it did impact some of our staff, but a few people compared to, nearly 200 people. And so that was a loss as well. And certainly, everyone is vigilant around all kinds of other changes of the federal government, whether it's related to NIH grants or USDA funding in general, all of the changes around, I want to say, DEI and how we engage in that work that has been a big part of our organization as well. And that's just off the top of my head. A lot of concern within our immigrant communities and how that impacts our work. And we've been responding as best we can in support of our immigrant colleagues and, communities. And so it really is just kind of very wide reaching, the impacts of the changes that we're seeing budgetary and policy wise and otherwise, in terms of uncertainty and what's happening next and what's going to stick and all of that. So those are just a few examples. Thanks for hanging on to discuss that. If anyone has other questions or comments, or if you want to share from your experience any of these things, I'd be happy to hear.
Thanks, Amira, for addressing that. Yeah,
Of
I think it's
course.
been quite a challenging time, and it's great that we are finding ways to try to partner to support each other and see how we can advance the work. Yeah, despite some of these